Roseola Infantum, Xanthum subeatum, Asclepiades, Rubella. The skin lesion in Roseola Infantum is non-pruritic, rose-pink, maculopapular exanthum which blanches upon pressure. Summary: Roseola Infantum, Xanthum subeatum, 3-day fever is a viral exanthematous infection caused by the human herpes virus 6, in rare cases human herpes virus 7, that mainly affects infants and toddlers. Infection is characterized by high fever, which ends abruptly after 3 to 5 days, followed by the sudden appearance of a maculopapular rash. The rash generally appears mainly on the trunk, but sometimes spreads to the face and extremities and fades within 2 days. Roseola infantum is a self-limiting condition that is only treated symptomatically. Febrile seizures are a possible complication of infection. However, most patients recover from these seizures without any adverse outcome. Epidemiology: Roseola infantum most frequently occurs in infants and young children. Peak incidence is in 6 months to 2 years of age. Almost all children are seropositive by the age of 3. Etiology: Causative agent of Roseola infantum is human herpes virus 6 and in rare cases human herpes virus 7. Humans are the sole hosts. Route of transmission is droplet infection, for example saliva. Incubation period of human herpes virus is 5 to 15 days. Clinical features: Febrile phase. The duration of febrile phase is 3 to 5 days. Fever: Abrupt onset of high fever in some cases greater than 40 centigrade (104 Fahrenheit). Febrile seizures are a potential complication of roseola. Cervical, post-auricular and or occipital lymph adenopathy. Inflamed tympanic membranes. Nagayama spots, papular enanthem on the uvula and soft palate. Other possible symptoms: mild upper and lower respiratory symptoms, pharyngitis, cough, etc., vomiting and or diarrhea, conjunctivitis and edema of the eyelid. Exanthem phase. Duration 1 to 3 days. Characteristic presentation: subsequent sudden decrease in temperature and development of a patchy maculopapular exanthem, rose pink in color, blanches upon pressure, non-pruritic in contrast to the drug allergy rash, originates on the trunk, sometimes spreads to the face and extremities. The names of the disease reflect its two phases. 3-day fever refers to 3 days of high fever. Exanthem subitum describes a sudden exanthem upon fever cessation. Exanthem subitum roseola infantum, a 1-year-old child with a recent febrile illness who developed a non-pruritic, blanching erythematous maculopapular rash beginning on the trunk and spreading peripherally 1 day after the fever subsided. The pictured rash and history are consistent with exanthem subitum, also known as roseola infantum or sixth disease. This began This benign disease is usually caused by human herpes virus 6 and may also cause a cough, runny nose, and/or diarrhea. Roseola infantum, sixth disease, exanthem subitum, pathogen causing roseola infantum is human herpes virus 6, rarely 7. Course of the disease: symptoms resolve within hours to maximum 3 days. Complications are febrile seizures, encephalitis. Treatment is symptomatic. Vaccine is not available. Incubation period is 5 to 15 days. Contagious period Contagious period is right before the onset of exanthem and after it. Symptoms of roseola infantum are exanthem, pale red blanching, macular or maculopapular rash, especially on trunk, edematous eyelids, cervical lymph adenopathy, bulging fontanelle in infants. Further symptoms: good general condition, high fever for 3 days before onset of exanthem, cough, rhinorrhea, abdominal pain. Diagnostics: usually a clinical diagnosis, lab test, antibody testing, human herpes virus 6 IgM detection is possible, viral DNA testing, pathogen DNA detection via PCR, possible detection using blood, urine, cerebrospinal fluid, or saliva samples. Treatment: symptomatic treatment, for example fluids and possibly acetaminophen to reduce fever. Complications are febrile seizures, meningoencephalitis. Prognosis: very good prognosis, self-limiting disease. The virus persists lifelong in its host, and reactivation of latent virus or reinfection may occur later in life, especially if individuals become immunocompromised.